All right. Welcome, welcome. We have Shannon Costa here with us today. And here at BP Harmony, I've always talked about bipolar disorder and all things related to mental health. But one of the things I'm finding out more and more is that there are special considerations for women specifically. And so that's why now that I'm starting this community, I want to have very intentional conversations about women's health. So Shannon is someone that I've known almost a decade now. I think maybe 8 or 9 years. We first met in when I was a student in Berkeley, California, and she married one of my close friends. He was my roommate at the time. So good family friends, and I recently visited their home and their beautiful children. But Shannon took an interesting path in her career. Shannon has a bachelor's degree in Asian studies, and recently, many couple of years ago, completed her training and certification as a doula with the Doulas of North America, DONA, correct me if I'm mistaken. So I thought, wow, let me talk to someone who knows about the world of pregnancy, delivery, um, postpartum, and all things related to health for women when it comes to that aspect of a woman's life. And then seeing from her experiences, she was just telling me before this call some of the very powerful and profound experiences that she's had witnessing the birth of women and the various circumstances. And so I'm curious to know the mental health aspect of it as well. So welcome, Shannon. Thanks so much. And I think maybe we can start off the conversation by asking the question, what is a doula?
Sure. So a doula comes from the Greek woman who serves. Um, it's a position that has been held everywhere in the world. It's women helping women give birth. It's nothing new, although the term can sound new, and with the medicalization of birth, especially in the West, um, it's kind of like a thing that's coming back. And it's a woman who gives educational, emotional, physical, and often spiritual support before, during, and after birth. It can look very different in the vast multitude of experiences women have in these areas. So it could be me, like, giving physical support to a woman during a contraction, but it could be me, um, you know, telling her husband that everything's okay because he's worried about what's going on. It could be me asking the providers that are taking care of her more information about what they're proposing to do. Um, it's a lot. It's a lot of different things, and I'm learning more and more with each birth, what a doula is and how I can help.
Nice. And so based off of what you're saying, do you do like is a doula something like a midwife, or what are the difference between a doula and midwife? And do you only do deliveries at home, or do you go to hospitals as well?
Mhm. Yeah, a lot of people ask that question. What's the difference between a doula and a midwife? And um, it's a pretty big difference, but there is a lot of overlap. So midwives are solely responsible for the health of the mother and the baby. They have extensive knowledge on the birth process, like what happens when women are trying to get the baby out and there's like a problem, like something stuck. They are responsible for the lives of the mother and baby, whereas a doula is not. She's not a medical provider, but she has a lot of knowledge about what happens in a birth. And she can often tell you, for example, like if you're in a hospital setting, I often explain to my couples what the monitors are saying, what are the normal ranges of the heart rate of the baby, and what the contraction pattern means, and what I'm pretty sure the nurse is going to come in and say in a minute. So, there's a huge overlap, and I try to make it one where I empower the couple to make the best decisions that they can about the care that they're receiving in an unbiased way. And that is a little bit hard at first because, like you said, where do I practice? I practice everywhere. I've been to home births. I go to hospitals most of the time because the Muslim community that I serve here, um, they usually choose hospital care. But I've also been to a number of birth centers, and those are kind of like an in-between and a
Mhm.
really great place, I think, for people who are interested in natural childbirth but aren't really quite ready to do it at home.
Yeah.
So I go to all those three places, and there's always a nurse midwife, a certified nurse midwife, or a lay midwife. There's a couple different types of midwives, but there's either a midwife present or an obstetrician. And
Mhm.
they're the ones that are responsible. And if I ever see anything that I'm like, oh, that looks like we should get an opinion, or I'm always advocating to talk with a provider, and I'm not the one giving like straight up medical advice,
Yeah.
like a provider would.
So I guess in the context of, typically in America, people go to the hospital, they get checked in, they've got nurses, they've got doctors, they've got specialists. Why do you need a doula, or why do people opt to get a doula? And maybe
Hmm.
have scenarios in which, having a doula was necessary or critical uh,
Right.
for the success of the delivery.
Right. So none of those providers you mentioned, um, none of their positions say that they provide emotional, physical help for the mother.
Mm,
Nurses, they're in and out. Like some of them are incredible and they do provide a lot of support like that. But just the nature of their job description, like they are worried about getting like the heart tones and worried about, making sure they follow all of the hospital protocols. That's what they have to do. Hiring a doula that doesn't work for the hospital has shown in studies to be far more superior than relying on even there are some hospitals that hire doulas, but because they're not a part of the power structure and they're able to provide a very different type of support in that
mm,
they've experienced this, they know how this goes. They're, you know, they know
yeah,
how to support women in birth, but they're not a part of that team, and
yeah.
they're bringing this other perspective, and they can also support the husband, or if the mom brought her mother or her sister, and they can show them how to support their daughter, the woman who's in labor, because a lot of times people are like, well, I'm going to have my mom there, I'm going to have my husband there, and that's fine. But they might not know how to support during labor and birth, and they might not know the things to do and when to do them, and to
Mhm.
have like the quickness to be like, oh, you're feeling nauseous, let's get out some spearmint oil, and like you can smell that and see if it takes it away before trying Zofran that has side effects, so um,
Uh,
I'm there for that. Um, and there's been some recent studies, some really good studies. If your listeners are interested in the looking at it at evidence-based birth, there's a great podcast summarizing lots of different things around birth and postpartum. But one of their recent research blogs is about postpart or about doulas and how they help. And they say that women who have doulas overall have a higher satisfaction of their birth experience, regardless of how it went. Less use of induction methods, less use of pain medications.
yeah.
So these
That's
things.
one thing that's one thing I've noticed is just the increase in the level of C-sections and all of these things happening. And yeah, I mean, it's a very, what I've found it to be, a pretty highly contentious or high emotion, high opinions in this space. And one of the best advices I've received is from a woman, that it's like, well, it has to come from the woman that's delivering, that, the choices that she wants to make on how to deliver. But I think what I like about doulas and midwives is the kind of education that they provide prior to delivery day. So can you tell me a little bit more about your services as a doula at the either, even before getting pregnant or pregnancy stage and delivery stage and postpartum stage. Yeah, just like these three, what I generally know is these three stages, but maybe there's way more.
Mhm. Yeah, so in our first prenatal meeting um after we've both decided to work together, we create a birth plan. And I like to bring to the table all of the decisions that usually have to be made in a birth. And it is a little bit different for women who are having birth, who are giving birth at a birth center versus a hospital versus home. There's a lot less I have to do in terms of education and advocacy training if it's going to be a home birth or a birth center, because usually home birth and birth centers are or um, led by midwives who practice evidence-based care, which means they typically don't do a lot of interventions that are not necessary. Now, in a hospital, it's very different. They don't always practice evidence-based care because of hospital policies. For example, most hospitals require all women to have an IV port when they're admitted,
Hmm.
even though they're not planning on receiving fluids, antibiotics, pain medication, but they want them to have it there in place just in case. But what does that do to the psyche of the woman, who's coming in and like, okay, now I'm a sick patient. Now I'm like just an accident waiting to happen. In in birth centers and home births, they don't do that. They have the equipment and they know how to do it quickly if they need to, but often it isn't an emergency. Um, so I go through kind of in order of like, okay, triage, what happens? What are the things you're willing to do? And so you can have these discussions with your provider before the birth ever takes place. And I'd say the biggest piece of advice I give to my clients when we first start working together is to choose a provider that you're absolutely comfortable with, that you trust, that you feel like they actually care about you. Um, and that could be an obstetrician, it could be a midwife. But if you don't feel that way, it's really going to determine how your birth goes. And of course, a lot of practices have several OBs or midwives, and you get who's on call, and that's fine too. But make sure that you get a chance to meet at least most of them, and you ask them about kind of their general culture in their practice, and like, are the things that you're requesting going to be okay with all of the providers? Because that might not be the case. And it can be really devastating if a woman plans to do so many things in her birth and she gets there and they're like, no, honey, we're going to do this because that's what's best for you and baby. And there's like a lot of this kind of uh, condescending talk to women, especially when they're in labor and they come in and we're like, look, we know how to do this and you don't. Listen to us, we know what's best for your baby. And so I really try to educate my clients the best that I can. Um, and we talk about, like I said, like when you first check in, what are the things, you know, um, what's evidence-based and what's not. Like eating, for example, it's not evidence-based to fast when you're in labor. And I can go into that, but I'm not going to now. But those are some of the things I talk about. And then, of course, like during the birth of the baby, like, do I want to be pushing on my back? Because that's how the majority of women give birth in the US, is on their back. And evidence says that's not actually the best way to do it. And so does all the historical accounts of women giving birth. Um,
Yeah, and I think I've seen it online too. It's kind of like front facing or like in like a like in a bowing position or like leaning against something.
Exactly.
Yeah.
Yeah.
That's
Forward leaning, letting gravity help you out. And I mean, that's the way that Miriam, they gave birth in the Quran. She's hanging on to a tree. And it's like, you can do that. You can hang on to a bar. You can hang on to,
that's
at birth
true.
centers, they have things that you can hang on to and give birth. And that's great. You're working with your body. So, avoiding giving birth on your back, avoiding interventions that aren't medically necessary. I teach them how to ask questions
Mhm.
using an acronym BRAIN, like what are the
Just
benefits?
This is in pregnancy stage or in the delivery stage?
So this is something I talk to them about in our prenatals. And I
Oh,
say, this is the acronym you can use when you're in your birth setting. And they're like, well, we think we want to break your water or something like that. And then you can be like, well, what are the benefits? And then they'll tell you what they tell you. And of course, providers are not always going to tell you everything. But if you trust them, if you did your work beforehand and you chose a provider that you trust, that you feel cares about you, that you feel safe with, then chances are that they will tell you what they believe and what they
mm,
think and what the real benefits or risks are. So the benefits, the risks, the alternatives, because often there are alternatives if it's not an emergency. What does my intuition say about it? And that's really huge for women because they really do, of course, care about their baby, but they also have a deep understanding of what their body needs to do. And really good providers understand that and encourage women to use that and to really be in touch with that, especially when it comes to moving around in labor, because the baby needs to get out and, your body moving is really crucial to that. Um, and for nothing. What if we do nothing? What if we just watch and wait? So that's something that I want them to have on their fingertips because it can be a hard situation to always think about questions when they just tell you this is what we want to do and this is why we want to do it.
right,
Okay.
right.
Or they won't really even, sometimes they don't even frame it like a question. They're just like, this is what I'm going to do, and I always want to ask my clients, like, is that okay with you? Even if it's something that you can't avoid, but just having her say like, yes, I do agree with that. Even if it's a cesarean and they say it's absolutely necessary, that makes a big difference. So that's the first appointment that I have is all about the birth plan and a lot of decisions to be made during the birth, even after the birth. Like, what are the medications given to the baby, and what are they for? And do we need them right away? What are our options? Like, can we do them at a later date? Um, how long do I have to stay there at the hospital? Can I bring my children there? At a different setting, you don't have to worry about that as much, especially home birth, because everyone leaves and you're left to sleep and rest, and then your midwife typically comes back the next day to check on you, so you don't have to go anywhere. So I think that's wonderful. But making sure they also have resources for lactation, because that can be really challenging especially for first-time mothers.
Yeah.
Um, yeah, so that's the first kind of meeting, and we go through a lot, and then some Islamic traditions, and I make sure that they know that, and I always want to tell people this, that Muslims honor the body by burying it and by burying anything that's from it, especially organs. So take your placenta home and bury it. Don't let the hospital have it. Um, I have, I don't know how many placentas, 20 maybe, buried in my backyard.
Oh, wow.
Yeah, so my sons helped me bury it. Yes. Perfect. Great. I'm gonna say salam to Uncle Imran. Hello.
Hi, Idris. Do you remember me?
Yep.
It's
Do you
good to
want
see you.
to do you want to watch something else, or do you want to look at pictures for a little bit?
I want to watch something else.
Because we're still talking. Can I be right back? I'll go turn it off.
Turn it off.
Do you want to watch one more?
Oh, yeah.
Awesome. I mean, a lot of what I'm hearing, it just feels like there's a lot of empowerment that happens for women, not just during the delivery process, but even while they're pregnant. And that's one thing I'd like to ask about is, I focus on patients who are or clients who have bipolar disorder who are already dealing with. But let's just talk about someone who does not have mental illness first. And what I've seen is that there are challenges for, mental health, specifically during the pregnancy phase. Sometimes the first trimester is very difficult. The last trimester has difficulties. I've just heard generals, but I know every woman is different. Sometimes every trimester can be difficult. So as a doula, and now that you're presenting this online and hoping for this to get out there, what general advice do you have for women to take care of themselves, especially their mental health, during the pregnancy phase, during the delivery phase, and especially, with the postpartum depression, in the postpartum phase?
Right. I think part of it I answered already, knowing who's going to be supporting you during the birth is really important. Um, Making sure you feel that you trust them and you're in good hands, but also thinking about who else is going to be there. Um, some women want their mothers to be there or their sisters, but ask yourself why and if that's for you or for them.
Mhm.
Um, and know that there are alternative um, ways to go about that if you don't feel that it would be beneficial, that you can give them other jobs, especially postpartum. There's a lot of jobs that
Okay.
can be allocated. Um, and in the before the birth, becoming educated and thinking about what your opinion of birth is. And for a lot of women, it might be an overwhelming fear of pain.
Mm.
That's what a lot of women are anxious about. And I just worked with a client last week um, who gave birth. It was her third, and she had developed like a postpartum psychosis after her second, and she didn't sleep for 5 days straight. Um, and I felt like, wow, this woman, subhanAllah, she went through this really difficult time and she's still very excited to have another one, but she knows that this is something that might happen again. And she was in close contact with me before the birth, talking about how she was feeling, and she was getting a lot of anxiety. And I told her, like, she was talking with a mental health counselor, and I think that's another recommendation I have, is to have someone, to talk to before, leading up to the birth and after, who's going to check up on you, who's going to watch out for all the signs. This is not my specialty, but it's theirs, and they'll know. Um, so to have that put in place and to keep close contact with them. But I am a big follower of Aviva Ram, who I think I mentioned her to you before. She's a midwife, she's a Yale trained MD, and she's an herbalist, and
Yeah.
she specializes in women's health. Um, and she has this wonderful book that just tells you all of her protocols for herbal medicine. And it
Cool.
also tells you allopathic medicine, like what they usually do in
Cool.
mainstream medicine. And I was just like, well, you can try motherwort tinctures. And she's like, okay. She didn't even know what it was. And I was like, and I make tea with motherwort and lavender and, other nervines that help, calm the nervous system. And she did that. And she just ordered a whole nother bag from me yesterday. So,
Awesome.
you can do these things that aren't, mainstream medicine, and they could be enough to help you get through. Um, and alhamdulillah, she was planning on a natural unmedicated birth, and she had it, even though it was hard, and even though she felt anxiety even during the process. She was afraid that she wouldn't be able to handle it.
Mhm.
But she did. So I think I haven't had our postpartum meeting yet. I do one postpartum meeting and we go over the birth.
Okay.
We process it. I take notes during the birth the whole time. Um, times and what happens so that it really helps women order in their minds, like, okay, this is what happened, this is when, these were the names of my providers, these are some of the things I might have said or my partner said.
Yeah.
And that really helps with processing. And I give
Wow.
them a lot of time to like, oh yeah, that's what happened. And this is what I didn't like about that, or I did like, and so we're going to do that. But I think that was a good example of just, her using different resources, knowing that this is what's happening to her, like, oh, this is familiar, I've had it before. And she's also seeing a lactation consultant because she's having some issues um with latching, even, even if it's your third, sometimes it's still difficult. So she's using all the resources she has, and I think that's awesome. And she had a doula for each of her births, and she just knows that she needs support and she gets it. And I think that is like the best example of someone who's like they know they're experiencing some challenges, they anticipate it, and so they're putting in place the care that they need.
Yeah, I mean, all the resources that you're mentioning here, please do send them my way, and I can post them along with the recording for this so that the viewers can find these references that you're making. The second thing that when you mention these meetings that you have to help process, it reminds me of some people who don't read books, and both myself and your husband, we're both readers, and people ask me because I'm in the suburbs. They say, "Why do you read so much?" And I say, "Well, the person who reads books lives 1,000 lives in one lifetime." So that got me thinking. It's like, well, the woman who witnesses 1,000 births, you're living many, many kind of like profound experiences. So I say that to reflect, in saying that it must be a fulfilling, meaningful career that you've chosen for yourself.
Absolutely, it is. And I had a doula for the births of my two sons, the same doula, and I'm so grateful for her and like her just her presence, and I encourage all women, to think about what kind of support they'd like to have in birth. And it doesn't necessarily have to be a certified doula, but someone whose presence grounds you. It
Mhm.
can be it can be
Yeah.
so transformative. Alhamdulillah. And yeah, the births that I'm so glad. And, I get a lot of women who tell me, I couldn't have done it without you. And I don't believe that. But I do believe um, that, Allah has put me in a place where the little things that I do make a huge impact.
Yeah.
Just learning like positioning and, counter pressure and, um, you know, a little bit about herbs and oils, and then like, wow, it really changes experiences and it helps families create empowering memories around the birth of their child, which leads into parenthood and creates more confidence and inshallah more, loving and sound families. And that's kind of the goal here. Yeah.
Beautiful. I mean that's important because like you said, there's the technical expertise in the medical field, but sometimes we see pregnancy can be something very challenging on relationships, and it can lead to the breaking of a relationship, whether it be marriage or not. But I want to shift the conversation a little bit more towards the mental health side. And well, I want to hear from you, from experiences that you've had of working with clients who had a pre-existing mental illness, whether it be depression, bipolar disorder, OCD, even something kind of, more extreme like schizophrenia. If you have experiences like that, and the backdrop behind this question is for anyone who gets a bipolar disorder diagnosis, the question in their mind, and this was a question for myself for a long time, is, well, if this is something that I have, I would feel terrible if this is something that I passed on to my
Mm.
children.
Mm.
And I don't know if I could live with that guilt if my child has a mental illness like myself. And of course, I went through my own process of understanding that mental illness is like any other illness in life, and that there are things one is born with, that there are we're predisposed to certain illnesses, but we know that every precondition can be there are preventative measures to take before they get bad, and to always be, vigilant and protective of those fragilities in our genetic makeup. So my question is, yeah, what is your experience, and or what is your advice to someone who has dealt with mental illness in the past and is thinking about getting pregnant? Uh,
Mhm.
what are some things that you have said in the past with people you've worked with, or what you've learned in your training?
Um, yeah, I think, I've worked with it, I've told you the story about the woman who knew and who got the support she needed. But I've also worked with a woman not very long ago who didn't talk to me at all about her mental health challenges, but her husband did, and her husband told me that she made a couple of attempts on her life during the pregnancy. But to an outsider, she looked completely normal and fine and happy. Even during the labor and the birth, she was just seemed like a typical mother who was struggling through it and got through it and was grateful. Um, and her husband was just kept telling me he was so worried about her. And if there's resources, and I gave him the resources that I have in this area, but he said, she is upset when he mentions them, and she doesn't want to admit that she needs them, that kind of thing. So
There's
I
a bit of
think
taboo. Yeah, there's a bit of taboo around mental health, and in our culture, it's like you're either normal or you're crazy. Like there's nothing in between. So there's a lot of shame associated with mental illness, unfortunately.
yeah. And it's so hard. I actually feel like I don't know, other than being there and hearing her and giving her time to talk and giving her advice about the other things that she is telling me about, resources. Um, I feel like I'm actually not equipped yet. And there are some doulas who are. And I signed up for a training with the postpartum support international. I think I might have told you about that. It's next month, because I feel like now I've been doing this for 2 years and I've seen what I've seen, and I want to have more tools in this area. Um, because it's something that's so needed. I was just looking on their website, I think it's 1 to 2 of every 1,000 women experience postpartum psychosis, which is, there's baby blues, and then there's postpartum depression, and then there's postpartum psychosis, where like women actually like turn a switch and do something absolutely horrible. And
Wait, what is the ratio?
a 1 to 2 in every 1,000. Yeah.
2%?
1 to 2 women of every 1,000.
Oh, every
Sorry.
thousand. Okay.
Yeah. Yeah. And we did a little bit of this in our training, and we had a specialist come and talk to us. And it's just absolutely horrible stories, and women who are very good women and who no one would ever expect to do anything that like they did. And yeah, so knowing the signs, I think, is, what I know now, and knowing that they need help right away. And that could mean, hospitalization, or it could mean a combination of medication and therapy, but that it's totally curable, and that, women just need people around them to notice it and to care and to support them, because I think we're often so isolated. And after a baby is born, some people are like, well, let's just give them space. But historically, like, women don't need space right after they give birth. They actually need a lot of physical support, a lot of presence, a lot of like taking the baby so the mom can sleep, having someone clean the house, having meals like come at appropriate times so they're not like bombarded with, 5 meals in one day. So there's like the meal train that a lot of people are using now, which is really nice because you can request certain times and have people sign up
Yeah.
for certain days. So those resources are amazing because it seems like, oh, it's just food, it's just cleaning your house, but those things could be the tip of the iceberg for the
Yeah.
poor mom, who's been up all night, who has cracked, bleeding nipples, who's just like really like, what do I do? My baby is staying up all night and sleeping all day, so a good, class on baby care before the baby's born can
Yeah.
be
So
really vital. Like, how do I get my baby to be like on a normal, healthy schedule that allows me to rest, that allows me to eat, that allows, um, me to feel confident in the way that I'm taking care of my child. Inshallah, hoping that the husband has paternity leave or um, other people in the community or family who can come and actually like be there with her
yeah.
because it's so hard to be alone after you have a baby. And I know what that feels like.
Yeah.
Hard.
Yeah. I mean, definitely your advice is on point about getting connected with the right resources if you know you have an existing mental health condition. One of the things that I'm familiar with is the kind of the standard protocol if you meet a psychiatrist and you are thinking of getting pregnant or become pregnant, then your psychiatrist needs to know this because there might be medication that the woman is on that may be detrimental to the fetus, that may be
Right.
detrimental to the development of the child. And so one thing that I will say for anyone who is on medication especially, um, to speak with the psychiatrist right away who's prescribed you those medications so that there is just you've made the check that there is no medication that is dangerous to
Mhm.
the development of the child. And then also to have the serious conversation with the psychiatrist on how the hormonal changes during pregnancy and delivery and afterwards are going to play a part of um, the volume, the volume change in the existing mental mental illness symptoms. For
Mhm.
bipolar disorder, it's vacillating, mood swings between, kind of high level manic, hypomanic states to low level, more depressive states, and they can go into their extremes of psychosis, delusional thinking, and then all the way to, you know, uh, a deep depression, suicidal ideation, and what I've seen in the pregnancy space is that they can happen quite dramatically out of almost
Mhm.
out of nowhere, and they're quite overwhelming emotions to deal with, which can then, as you mentioned, lead to harm to self or harm to others.
Mhm.
But you do bring up an interesting point about men and the paternity leave being a big part of it, but what are some other pieces of advice that you would give to men in who are part of the pregnancy journey?
Mhm.
Uh, typically men might say things like her hormones are all over the place, like she's
Mhm.
just acting, you know,
Right?
I don't want to say the politically incorrect things, right?
Yeah.
But
Yeah.
all the things. And they're
Yeah.
like, I just don't know what to do.
Right.
Uh, so what are some things that maybe in your work, your line of work as an advocate, because
Mhm.
it's like there's a lot of empowerment that occurs for the woman, are there things that you do for the woman by also um
For the man.
educating the man?
Yeah, I do. I do during for birth too. I give the oxytocin talk and I'm like, the oxytocin, the love hormone, is what she needs to get this baby out. And you need to show her that, like in labor, and make her feel safe and loved. Um, and listen to her body, even though it might look like strange or whatever, and don't think that this is an emergency because birth is a natural physiological process, just like the other processes that we have that we go through all the time at home without any medical assistance. So just to believe that at a core level, like if she had her baby at home, it would probably be fine. If it was like an emergency and it's like, oops. And then just tell them, like, you would just make sure there's not a cord around the neck. You don't have to cut the cord, you know. If you call, you just be prepared. They might want to, take the baby separately in a different ambulance, or you can go by yourself in the car if everything's okay. So I kind of just talk to them about it in a very real, calm, natural way. And just like, this is an okay thing that happens in life. And then for postpartum, I say that the hormones have to hit rock bottom before they can level out again. And that typically takes about 2 weeks.
Oh,
Yeah, I don't know all of the exact terms for that, but that's something I learned from Ustad Nidal in my birth education class I took with her before Idris was born. And it's normal to be teary, to really like mourn for maybe the lifestyle you had before, or even the relationship that you had with your other child or children before this child came along. Like, that's completely normal and should be encouraged. Like, when Idris was born, I was like devastated because I felt like I was losing the relationship with my first son, Noah, and Scott, my husband, said, it's because your heart is so big and you love him so much. And he would just encourage me to cry, even though I was like, I felt like, wow, like this is really overwhelming. I didn't expect this, but that was just kind of a natural part. And as long as it wasn't, leading to like, harmful thoughts or anything like that, it should be encouraged and respected, and just like treated with a lot of love and concern and care, because there was nothing more that I needed than for my husband to just say, that's fine, let it out, you have a big heart. And I look back at that with like kind of a fond memory, even though it was like it's kind of strange, even though it was so difficult in the moment, but it had to happen. And I think it was kind of a healthy process, even though it didn't look like my everyday normal happy self. But then, when it comes to like, okay, she's exhibiting things that are not okay, then to make sure that men know like who to call for support that the woman feels comfortable and safe with too. So I think finding those things out, those resources out before the birth, can be really nice, even if she doesn't need them. Just be like, well, in the case that it could be a part of your birth plan, I should do that. in the
yeah.
event in the event that I do have more than just a normal baby blues. If it goes past 2 weeks, if I feel really down and don't feel motivated, who would I feel comfortable talking to?
Yeah.
So that you have that already there, and you just do it. You just go to that plan and you're like, okay, let's just do this now and see what we can do. Yes, Habibi.
You're still watching tonight. So Mom want me to watch something else?
I guess so.
So lovely to see that while you're still doing services for the community, you're also raising a family. You're a mother, and I appreciate the origin story you always tell to your kiddos that I had some part to play in it.
You did.
Yeah.
Yeah.
Uh, well, thank you so much, Shannon, for this lovely conversation. I learned a lot. I know our viewers will benefit from it as well. Um, I'll leave you to make any sort of comments you feel like maybe we didn't cover today that you are burning and you'd love you really want to share. Um, I'll allow you to make your final remarks for today, and then we'll conclude.
Sure. Thank you for having me. And I think what you're doing is amazing, Imran, that you're just growing with your experience and, reaching reaching other people at a really deep level. So I have a lot of respect for that, and um, I appreciate you having me here. And I just really like people to know that, you know, birth is really transformative and a special sacred event, and it should be treated as such, and you only give birth to your child once, to each child once, and you shouldn't settle for anything less than you feel you deserve. And often it takes a really supportive provider or people around you. So get those people. If it means having to hire a doula, that's a really good option. And that's what I'm doing. And um, I feel, like you said, incredibly blessed to have this opportunity. And I think most of my clients would say the same, that they're really glad that they had me. And I don't say that about myself, but just, from what I've been able to bring, from what, doulas can bring. And that can go a long way with mental health, um, and all areas of health. So, inshallah.
Yeah, no, I'd love to have more conversations in the future. Talk about natal yoga and nutrition in the pregnancy stage and all of those things. I'd love to help, build more content that is beneficial for the BP Harmony community. And then totally forgot to mention, the Coastal Crescent community as well. That's
Oh,
for practice. I'll be sure to put your website on this posting as well, and then we'll take it from there. So thanks again, Shannon, and hope to have you for future sessions.
inshallah. Assalamu alaikum.